Hello, my people, welcome back. So now we're going to talk about the etiology, what I call etiology, where I've been telling you before now, the causes, the things where they cause, the microorganisms where they cause this condition, this particular thing what we call pneumonia. So we go put them in a way where they very easy to understand. So we go describe, we go classify, okay, pneumonia based on the clinical settings where it carry occur. Okay, so the kind of clinical settings, the kind of way where we see them clinically, the way it been come in clinically, we'll classify them like that. Then we'll come talk about the microorganism where they cause each of these particular clinical settings of pneumonia. So we'll talk about 7 clinical settings. Okay, we'll talk about 7 of them, 7 clinical settings. So if you take your pen and your paper, you maybe write them down. So the first one, okay, now community acquired acute pneumonia. Community acquired acute pneumonia. The second one now, community acquired atypical pneumonia. Community acquired atypical pneumonia. The third one now, aspiration pneumonia. Aspiration pneumonia. The fourth one now, necrotizing pneumonia and lung abscess, if you add them. Necrotizing pneumonia and lung abscess. The fourth one, or now the fifth one, is chronic pneumonia. Chronic pneumonia. The next one now, pneumonia in immunocompromised patients. Patients will be say, if you check now, with the hospital, then they immunocompromised. And the last but not the least, now hospital acquired pneumonia. Pneumonia where you get from hospital settings. Understand? That pneumonia actually is also a very special type of pneumonia. So let me start quickly. I don't classify them now. So the first one now, community acquired acute pneumonia. So community acquired atypical pneumonia, number 2. Number 3 now, hospital acquired pneumonia. Number 4 now, pneumonia, necrotizing pneumonia and lung abscess. Number 5 now, chronic pneumonia. We get pneumonia in immunocompromised patients, and we get aspiration pneumonia. So these are the different clinical settings where you find these pneumonias. Okay, these where various microorganisms they involved. So now make we start from the first one. Now the first one, now community acquired acute pneumonia. Community acquired acute pneumonia. Now this one is one of the first forms of pneumonia where we say being come out. Okay, where we say doctors be they easily they diagnose. So now waiting be the microorganism, okay, where they actually the cause, where they responsible for community acquired acute pneumonia. The microorganism, the list plenty, okay, but I want to make you know the typical ones. The typical ones. The first one is Streptococcus pneumonia, and then we'll get Haemophilus influenza and Moraxella catarrhalis. I'll take them again. We get Streptococcus pneumonia, Haemophilus influenza, and Moraxella catarrhalis. We get other ones like Staphylococcus aureus, Enterobacteriaceae, which will be Klebsiella species. We get all those ones. But if you know these 3, now the typical bacteria where they easily seen in community acquired pneumonia. So I will take them again. If you remember them now, Streptococcus pneumonia, Haemophilus influenza, and Moraxella catarrhalis. So these are the agents that are involved in community-acquired pneumonia. Why are they important as we classify them like this? So as the doctor, it don't help you to narrow, the cause of the disease and know which type of pneumonia where the person gets and which setting. So if you, for example, now the person come and you don't find and say waiting day, you see this and that, say okay, this is a community acquired pneumonia based on the facts saying a streptococcus pneumonia where you see there, or Haemophilus influenza, okay, or Moraxella catarrhalis. All right, now make we go to the next one, which is community acquired atypical pneumonia. Now you ask yourself, why this one they atypical? Remember, as I talked before, say the first one, which was community acquired acute pneumonia, now the pneumonia will be there very common, where practitioners be easily diagnosed. Now this the other one will be atypical. Now pneumonia, now condition where they can later find out say it look like pneumonia, but you don't get the classical clinical signs and symptoms and features where the first one where them been find out where be acute pneumonia been get. So they can't call them saying the name now what? Atypical. And truthfully they are atypical because the major microorganisms where they cause this atypical pneumonia they actually are different from the first one. So the first one here is Mycoplasma pneumonia. Mycoplasma pneumonia. Then the next one, Enterobacteriaceae, or what we call Klebsiella species. Okay? Enterobacteriaceae, or what we call Klebsiella species. So if you see, for example, Mycoplasma pneumonia, now classical number one when you talk about atypical pneumonia. So no ever forget that one. Now when you talk about hospital acquired pneumonia, no forget saying gram-negative rods. Gram-negative rods. So you go list all the gram-negative rods where these are not them they responsible for hospital acquired pneumonia. Now, when you move forward and you talk about the aspiration pneumonia, so this one they're very, very easy. Aspiration pneumonia means say the food where they for your gastrointestinal tract, you don't take them back into your mouth, then you aspirate them, it don't become an aspirate as you take them down into the lungs. So what thing will happen is say it go there mixed with the normal microflora where they your mouth, and then it will come go inside your lungs. So those normal microflora where they suppose their mouth will now don't go inside another location of the body where no they familiar with them, and they will come proliferate for the other, they will come multiply, complaint, they will come cause pneumonia. One of them are bacterioids. Some of those anaerobic normal microflora are bacterioids. Peptostreptococcus, Pavotella. Okay, so these are some of the anaerobic normal microflora where they the mouth, where the oral cavity, where will actually follow the thing go inside. So it's called bacterioids, Pavotella, and the other very long list, like Peptostreptococcus. Okay, all those ones will actually follow and go inside the lungs, and they will cause pneumonia. So this one now for aspiration pneumonia. Oh, I say now for pneumonia. All right. So, for example, when you talk about pneumonia in immunocompromised patients, I had to tell you now, see, this language not be our own. Pneumonia in immunocompromised patients. You go, for example, you go see this girovecii. Okay, this bacteria where they call girovecii, Girovecci. Okay, they very, 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 very common. Even Mycobacterium tuberculosis as well. It very, very common in this patient. Mycobacterium tuberculosis. It very, very, very common. Okay, even as well as Pseudomonas species. It also very, very common in immunocompromised patients. Okay, it is very, very important. Anaerobic bacteria, anaerobic microorganisms, now they cause bacteria in this necrotizing and lung abscess. You know, say anaerobic bacteria, they actually produce pyogenic, they are pyogenic, they produce pus. Okay, so they are usually connected with the anaerobic microorganisms. Okay, so and also chronic pneumonia, that one you go see an actinomyces, you go always the day there, nocardia, you always the day there, even Mycobacterium tuberculosis as well. Okay, all of them go also day there as well. Understand? So these microorganisms where I don't list, so now the microorganisms where they responsible to actually they cause this pneumonia in all these situations we don't mention, these 7 clinical settings, from the community acquired acute pneumonia where we talk about streptococcus pneumonia, Haemophilus influenza, and Varicella catarrhalis, okay, down to the hospital acquired or pneumonia where you go see say obviously those ones now gram-negative rods, okay, as well. Now you go there. And when you talk about the aspiration pneumonia, you see bacteroids, Peptostreptococcus, okay, those ones now you go actually they cause that one. Or when you talk about the nocardia, actinomyces in case of chronic, okay, or in the case of Mycobacterium tuberculosis, in case of immunocompromised patients, Pseudomonas species as well. So these medical conditions, these classifications of pneumonia, if you see these classifications typically present in a patient, you go understand that this particular microorganism. And if you see this particular microorganism, you go also understand that this particular type or class of pneumonia we get. The reason why this classification is very important is say most of the times when patient come to the hospital, patient needs immediate care, urgent care, okay? In that case, you know go fit do culture or staining, will be one of the ways we diagnose and know which microorganism they cause waiting. Okay, so those culture and staining they take time. So if the patient needs urgent care and you know get time to do culture and staining right now and right away and get immediate result, if you do your investigation, clinical clerking very well, you could actually understand or get a narrow view towards the particular clinical settings and the particular microorganism where they actually they're responsible for that particular condition. So now we don't know everything about the etiology of this particular condition. The next point we'll talk about are the clinical features. Okay, so stay put, not go anywhere. Okay, I go there around and we'll talk about the clinical settings. Take care.